the question on whether vaccines should be made mandatory couldn't be more urgent, as the Constitutional Court has dismissed the IEC's application to postpone the elections, leaving the Commission with less than 2 months, basically, to prepare for the local government elections. So, how can we ensure that the elections are not only free and fair, but also in this context of COVID-19, that they are safe? That's our focus of discussion this week on the Uncensored Debate. And let me introduce my guests. We are hoping to be joined by Discovery's Dr. Ryan Noach, the Discovery Health CEO. He's yet to join, but as soon as he does, we will connect with him. We also have Safura Abdul Karim, public health law expert. Dr. Nicholas Crisp is the acting DG of the National Health Department. And then we also have John Jeffrey, the Deputy Minister of Justice and Constitutional Development. Well, let's get on with this now. I see that Dr. Ryan Noach has also just joined from Discovery. My thanks to you all for making the time for this important discussion. How we kick off this segment is that we begin by asking an all-round question. We call it the opening statements. And my opening statement to you, I will start with you, Safura, is: should vaccines be made mandatory for everyone in the country? And you get to be the first to give us your thoughts.
So I think it's very important to understand that the term vaccine mandate can mean any one of a series of different interventions. When we talk about making vaccines compulsory in legal terms, we're not talking about going up to people and, irrespective of their desires, sticking them in with a needle. And so for me, what this is really about is creating an environment where people want to get vaccinated, where they're incentivized from getting to get vaccinated, and they're disincentivized from refraining from getting vaccinated. Yeah. And that would be a combination of things like vaccine passports, making it a requirement for certain types of jobs or being in certain high-risk environments, but also other types of more soft policy types of measures like education campaigns, etc. And I think with that suite, South Africa will be able to move into a new phase where we can truly live with this pandemic, as opposed to what we've been in for the past 18 months.
Yeah. Dr. Crisp, it's your turn. You tell us, as the department, as to whether or not this is something that you may possibly be considering. I know that the advisory team, who are not part of government, these are the scientists that advise you, they are already discussing this. But what are the department's thoughts on mandatory vaccines?
Yeah, thanks very much, Tole. So from our perspective, that's not dissimilar to what Safura is saying. We believe that we need to provide people with sufficient information to make a decision. We believe we should make a vaccine very accessible to people, so there's no excuse for them to be, not to have access to a vaccination site or a vaccine. And we believe that it is important that people understand that the disease kills you, and particularly for people who have risk due to age or various illnesses, this disease can create serious problems, and you ending up in hospital. So it's very important that people get vaccinated. But whether to mandate or make it a legal statutory obligation to be vaccinated is not the desired route for the government or for our department. We don't see from a health perspective that that is necessarily the way to go, but we would certainly support that in certain workplaces and environments there should be incentives and disincentives to make sure that people are vaccinated in those environments.
Yeah. John Jeffrey, from a legal standpoint, where does government stand as far as mandatory vaccinations?
Look, I think Dr. Crisp has outlined government's position. Maybe just to add that the President had said in February that people wouldn't be forced to vaccinate. He repeated that on Friday when he was answering questions in the National Assembly. But it is very important for people to vaccinate. I would imagine, particularly with your next two speakers, it's not an issue, I think, as the first speaker had said, of shoving vaccines into people's arms, but it's a question of possibly restricting what they can do. As far as the constitutional issues, there's a right to bodily integrity. I think it's Section 12. There's a right to freedom of religion and belief. But all the rights have to be read in context with each other. So those rights may affect somebody else's rights to life and their ability not to live because you haven't been vaccinated.
Dr. Ryan Noach, you are with Discovery, which effectively becomes the first company in South Africa to publicly announce that for all your staff, you are introducing mandatory vaccinations. Without getting into too much detail, we're going to get deeper into the discussion. Tell us what informed this decision. I think you're muted. Yeah. There we go.
Thanks very much for having me, and great to be part of this eminent panel. Just to say, this isn't a decision that we reached easily. It's been weeks and weeks of very tough and robust debate, multiple legal consultations and opinions, discussions with ethicists as well, to reach this point that our board concluded ultimately last week. Our position is simply that the data is unequivocal. Vaccines are safe and effective. And with the world having been administered now about 5.5 billion doses, and in South Africa with us having administered through the government-led program over 13 million doses, we have very reliable data to demonstrate safety and efficacy. So that's part one. Part two, as Dr. Crisp said, there is adequate supply and access. And certainly for us, by the end of this year, we're convinced that all of our employees would have easily been able to access vaccination should they want to by the end of the year. There is more than enough supply thanks to the government's procurement program and multiple distribution centers in both the private and the public sector. Yeah. So on the one hand, it's safe and effective, and on the other hand, it's accessible and affordable, free to all, right? Covered in full by medical schemes if you're insured, covered in full by the Department of Health if you're non-insured, so free to all.
All right. So
in our view, in order to make our workplace safe, we really want our people back at office. And in order to have a safe workplace, we feel it's important that our facilities, our offices, are vaccine-safe zones and that all of our employees are vaccinated.
All right. So those were the opening statements of our panelists. When we return, we drill deeper into what are the possible implications. Remember that you have a right to bodily integrity, and that is guaranteed in the constitution of this country. So let's continue this discussion with my panelists. But before we do that, as I mentioned earlier, the president addressing Parliament, or he was responding to questions from members of Parliament on Friday. And this question around mandatory vaccines came up. And let's have a listen to what his thoughts were around this matter.
COVID-19 vaccines reduce the chances of severe disease, hospitalization, and death. Madam Speaker, as I said in February of this year, no one should be forced to be vaccinated. Instead, we need to use the available scientific evidence to encourage people to be vaccinated, to protect themselves, but also to protect people around them. At the same time, our occupational health and safety laws require that we ensure a safe working environment. This situation poses challenges for employers who want to keep their workers safe from COVID-19 while respecting the rights of those who don't want to be vaccinated.
That's the President addressing members of Parliament on Friday. Dr. Noach, straight to you. You've heard the President. No one should be forced to be vaccinated. Your company becomes the first to make this mandatory for your employees. The question lingering in people's minds is, what will be the consequences for employees who opt out?
Yeah, thanks very much, and that is absolutely the core issue. And just to say that we're in support of President Ramaphosa's statement that at a country level it's not possible to mandate vaccination. We do think a feasible scenario is that specific locations, events, workplaces, activities could become mandatory vaccination areas in the future. And we think this bodes well for saving lives and livelihoods. It's very important, Koli, as you say, that we have a process for our members of our team who are not wanting to be vaccinated. And on an individual case-by-case basis, we understand that there are diverse views. We want to have an environment of mutual respect. We want to participate in meaningful and engaging conversations with these employees. One-to-one, individually, we will engage those employees. We will understand their legitimate rationale for not wanting vaccination. And if, in fact, their rationale is legitimate, we will seek to find reasonable accommodation for them within our workplace. It is only if we're unable to find reasonable accommodation, or particularly in cases where there are not legitimate rationale, that unfortunately we would land up having to part ways. Our aspiration and hope is that all of our workforce land up vaccinated, or that there are a few that have legitimate reasons for not being vaccinated, perhaps religious or health reasons, that we can find a means to accommodate them and protect others at the same time.
That brings you, Deputy Minister, into this question. You are in the Department of Constitutional Development and Justice. Dr. Noach says if an employee of the company does not give a rational reasoning as to why they do not want to be vaccinated, well, then we will have to part ways. Legally speaking, are those people protected?
Ultimately, it's a debatable issue. Ultimately, it would be decided by the court, by the Constitutional Court. So I can imagine if there is a dispute, it eventually going there. I think there's good grounds, as I'd said earlier. The rights in the Constitution are not absolute. They're limited by each other. There's a limitations clause in the Constitution. Already some of our rights are limited in terms of the right to travel. You currently can't travel to certain countries without a yellow fever certificate that you've been vaccinated against yellow fever. So if you want to go to that country that requires it, you've got to get vaccinated. There's going to be vaccine, it would seem, passports for COVID. So it's a balancing issue, and I think ultimately it would be for the court. But there's strong arguments about why you should have to. Maybe a quick international comparison. I mean, many other countries in the world have imposed requirements or are imposing requirements for vaccination, in particular of health workers. So, for example, Australia is doing that. They also required their Paralympic team to be vaccinated before they left for Tokyo. In England, it's going to be mandatory from October next month. And also people entering nightclubs or other venues with large crowds will require patrons will have to present proof of full vaccination. That's by the end of this month.
Yeah.
So it is happening in other places around the world, particularly health workers who are more at risk.
Let's come to you, Dr. Crisp. You are the Acting Director General in Health, and I put it to you, DG, that compelled vaccination is not new in South Africa when it comes to particular types of disease. For example, if you suffer from tuberculosis, the understanding is that you are compelled to vaccinate. So tell us what laws were used in order to make sure that that is enacted.
Yeah, thanks very much. So I don't think that any vaccination is compulsory in South Africa at the moment, and I don't think it ever has been. There are vaccination programs, and there are requirements for being vaccinated to enter various places, including certain schools, where schools might make that an environment for the early childhood development and so forth. That is a choice. So we will likely go in that same direction here, and you've just heard the Honourable Deputy Minister give an example. So if you want to go to a certain place where it's a requirement to be vaccinated, then you must be vaccinated. So whether you want to participate in sporting events, or whether you want to go to a stadium to watch a show or a sports match, whether you want to enter a restaurant or go to a certain church, there may be that for those particular environments, rules are put in place to allow the proprietors or owners of those environments to exclude people who are not vaccinated. That doesn't mean you have to be vaccinated. It just means you can't go there where it's a requirement to be vaccinated. The proof of the pudding will be in the eating, of course, and we need to make sure that there's a verifiable method for people to understand that when others are allowed into an environment where it is mandatory, that they are protected and comfortable, that everybody else who is in that environment is equally protected as they. Now, that is easier said than done, and one needs to do it in a fair, transparent, and comprehensive way that is not defraudable, because that is part of the problem around the world, that people defraud certain kinds of records and lie about their status. But we know, as we've just heard earlier from the Honourable Deputy Minister, that if you want to go to countries in the equatorial belt, you must have a yellow fever vaccine. In fact, if you try to re-enter South Africa having not had, or you lose your card, you are required to be vaccinated at the airport before you can re-enter the country. Yeah. This has been in place and is part of the international health regulations and has been for many years. Yeah. So it's how we implement things that we allow people to make their own choices of what they want to be excluded from or included in.
What do the laws say, Dr. Crisp, before I move on from you? What do the laws say if someone is infected with TB, and not just any TB, but XDR, extreme resistant TB?
Yeah, but that's a different issue from vaccination. Okay. That is treatment, and there are laws that allow for people who are infected to be protected from other parts of the community while they are being treated to the point where they are no longer infectious. So for non-multi-drug resistant or XDR TB, it's fairly quick to get somebody to a stage where they're not infectious. But they can be, when they are infectious like that, incarcerated. And in fact, there are provisions that we can do that now. We can isolate people. We don't do it very effectively, and because it's so widespread at the moment during a pandemic, there's not really the facility to do it for everybody who is COVID positive. But certainly when we're dealing with something that is relatively rare and extremely dangerous once it gets into the community, like XDR TB, there are provisions in the health laws to incarcerate those people while they are infectious. That's a very different story from forcing people into vaccination.
All right. Let's come to you, Safura. The understanding is that you made submissions, and I'm mentioning this specifically because we are edging closer to an election, given the decision of the Constitutional Court on Friday. You made submissions to the inquiry, if we were to call it that was run by the retired Deputy Chief Justice. And I would like to pose this question to you with that in mind, with the election in mind, that what is the level of vaccine acceptance among South Africa's population?
So, look, I will say, my expertise is as a lawyer. I do public health research, but I think there are other people in this call who are probably better placed to speak to this. I am aware of some surveys that have been done that indicate anything from we have a very high acceptance rate of vaccines, 75% of our population are willing to take it, all the way down to, we have 65% of our population who are vaccine hesitant. I think the problem with a lot of these surveys is that they're conducted with populations that are easily accessible, and that automatically skews the populations in different ways. So it is hard to know, with such a diverse population such as South Africa's, Are people truly vaccine hesitant? Are they struggling to access the systems that they need to register? Or are they really far away from services? And we need to support them to get them to these services. And then, of course, the picture of vaccine hesitancy looks radically different in different demographics. So, overall, we're a heterogeneous society. I think we're more heterogeneous than many others. So it's a very complicated thing to do. You can't have one message that's going to go and convince everybody in the country. We need to really think about what are the barriers to people becoming vaccinated and start addressing those barriers one by one.
Yeah, and I'm glad you mentioned that you come from a legal standpoint as far as public health is concerned. I'm going to go to Dr. Ryan Noach in a moment, and he's made it clear that failure by the employee to explain on rational grounds why they won't take a vaccine, then they may have to part ways as an employee of Discovery. Are there loopholes there, legal loopholes that people could explore, in particular Discovery employees?
Corley, you left out one step that I described in my process, which is to seek reasonable accommodation in the event that an employee does have a legitimate and rational reason for not being vaccinated. And just to emphasize that point, because you've omitted it twice in your representation of what I said, it's critically important that we make every effort to find that reasonable accommodation for the employee. But, there are lawyers on the call, and the Honourable Deputy Minister as well, who may have a much better legal view than I do. I'm a doctor, for full disclosure. But in the advice that we've received, it's very similar to what Deputy Minister was saying a moment ago. Constitutional rights are not necessarily absolute. They may actually be limited in terms of laws of general application, where they're balanced against the right of others and the rights of broader public interest. And there are various test cases and precedents around judicial pronouncements where the Constitutional Court set out that constitutional rights could be justifiably limited to protect others or for the broader public interest. In addition, it's important to note that the Occupational Health and Safety Act, which is the act that prescribes how employers must conduct themselves in respect of the workplace and the employees, that act, the Occupational Health and Safety Act, confers an obligation on us as employers to create a safe work environment for employees and not to put them in risk. And in fact, if you read the act, it specifically says that employers have an obligation to protect employees from hazards, including, as mentioned in the act, biological hazards. Now, I put it to you that the SARS-CoV-2 virus, which causes COVID-19, is indeed a biological hazard. And in fact, from a legal position, one could interpret that to say that we have an obligation to protect our employees against COVID-19. Looking back, we've sent our employees to work from home. We've enforced mask wearing. We've changed the way that they work in the workplace and out of the workplace. We've spaced out the desks to meet social distancing requirements. We've followed changes and rulings that have been gazetted in the Occupational Health and Safety regulations by the ministers and the Interministerial Committee to make sure the workplace is safe. And I would put it to you that this is another step to do similarly. Our intent is simply for our workplace to be a place where employees can come to work, have a sense of belonging, have a connectedness, and know that they are safe in the workplace.
All right. Let's take a short break. When we return, we're going to continue this conversation and perhaps reflect on what seems to be a debate that is gaining momentum as far as vaccine passports are concerned. We're going to continue with this, but also you will see that there's breaking news on the side of your screen, and it has to do with the former president, Jacob Zuma, who has been incarcerated. Well, a statement coming in the last few minutes stating that the former president has now been placed on medical parole. And I don't need to remind you that we have the Deputy Minister of Constitutional Development and Correctional Services here, John Jeffrey. I wonder if I could abuse him a little bit, but hopefully he will allow us. Let's take a breather. When we return, we continue the conversation. You are watching the Uncensored Debate, and we are discussing mandatory vaccinations. Discovery becoming the first company to announce that its employees will be required to take vaccines. And before we went on that break, you would have heard us mention the breaking news on the side of your screen. Deputy Minister, I'd like to get this out of the way so that we continue with the discussion. You are the Deputy Minister of Correctional Services as well, which forms part of the department that you run. And I just want to read one line from your statement there. It says, "We want to reiterate that placement on medical parole is an option available to all sentenced offenders, provided they meet all the requirements." Now, the question is, has the former president met this requirement? And I'm asking this on the back of the news that has been going around in the past few days around the former president refusing to subject himself to doctors that would have been appointed by the National Prosecuting Authority. So, has the former president met the requirements for placement on medical parole?
First of all, let me say, Toli, I'm not the Deputy Minister of Correctional Services. That is Nkosi Patekile Holomisa. Mine is Justice and Constitutional Development. So I'm not directly involved in correctional services matters. The issue of medical parole is something granted by the National Commissioner, as far as I'm aware, after following a due process. I would imagine that Mr. Zuma has satisfied all the requirements. Otherwise, they would not have been able to release him on medical parole.
Final question on this matter, Deputy Minister, and I thank you for indulging me and for that important correction as to your duties. The former president, as we all know, this is not the only issue that he has problems with in as far as the legal matters that surround him. He is still, he has many cases that he faces. So, should he be found and sentenced to prison on any of the legal matters that he faces, what happens now? Can he be sent to jail having been given or having been placed on medical parole?
Good question, but if he were to be found guilty of any of the charges against him, that is something that his lawyers would have to argue in terms of sentence. And I'm sure it would be a factor that the court would have to look at. But I'm sure if I were representing him, definitely that is something that I would argue. The defense lawyers would argue that he can't be sentenced to jail. Some other forms of punishment must be given. But that's still a long way off.
All right. Thank you very much for that explanation. That's the Deputy Minister of Constitutional Development and indeed other matters regarding law. But he's
Constitutional
made it clear.
Development and Justice.
Constitutional Development and Justice, indeed, as opposed to Correctional Services. So thank you for that. Let's get back into the discussion around mandatory vaccines. Dr. Crisp, let me come to you. Vaccine passports, is this something that is officially under discussion? I think the minister in the presidency may actually have made mention of it, answering questions from journalists on Thursday. Is this something that is now being discussed very strongly by government?
So this matter has been discussed for months already. There's a difference between the vaccination passport, which is a requirement would be a requirement to leave the country and enter another country, and some countries already do have such vaccination passports that they issue to people of their nations to travel. Every sovereign nation has their own vaccination program with their own rules and their own passport regulations. Some of them use different vaccinations from our own. So that's quite a complicated discussion. What is also being discussed for some time now in our context is vaccination certificates. Now, that is the same kind of thing that has been available in some European countries and other countries around the world for some time. That is a domestic confirmation that you have received a vaccination. At the moment, you get a card, a written card in South Africa, and you also get an SMS sent to you after you've been vaccinated to confirm you've been vaccinated, and with a code published on that SMS to confirm your vaccination details. Those are verifiable through the electronic vaccine data system, right down to the minutiae of the details of the dose and lots and everything. The question now is, how would that be used in society to protect those who are vaccinated from those who are not vaccinated? So we've had this discussion in the earlier part of this debate about you self-exclude yourself from certain places if you can't prove you're vaccinated. We need to have a secure, easy-to-use, confirmable, non-defraudable system for proving that you're vaccinated. And that's what we're busy working on at the moment, and that has been under discussion for some time. Our colleagues in the private sector have implored us to go this way so that the economy can be open. Colleagues in the sports and entertainment environments and restaurants and tourism have implored us to make such a thing available so that they can open those spaces safely. So yes, it is very certainly on the cards and is something that we are looking at extremely seriously.
Safura, how is this likely to go down with members of the public?
So I think there are two issues at play when it comes to vaccine passports. The first is, as Dr. Crisp has pointed out, it's not exclusively something that is determined by South Africa or South Africa's government. And there are a number of countries that have introduced that requirement that in order to enter the country, you be vaccinated. But there's a second level to this, which is there are some countries that are refusing to accept certain types of vaccines. And that, to me, is a very, very, very serious equity issue, because many of the vaccines that have been excluded from recognition by these countries are vaccines such as the Sputnik and Sinopharm vaccines that were available to low and middle income countries when Pfizer, Johnson & Johnson and others were refusing to sell us vaccines. So I think there's a very important broader debate that needs to happen around the introduction of these passports, and countries need to seriously consider when introducing this as a requirement, how is it going to affect and penalize different parts of the world? South Africa is in a position where we vaccinated just over 10% of our population. Many of our neighbors have yet to hit 1%. Our region has some of the lowest vaccination rates in the entire world, partly because of vaccine apartheid. And so I think, it's not just a domestic question of whether our public is willing to accept these things. We need to think about whether or not this is going to actually harm our economy or penalize other low and middle income countries by preventing them from engaging with the rest of the world because of vaccine apartheid and inequitable access in vaccines.
Yeah, Dr. Noach, let's come back to you. As per your decision as a company to basically embark on mandatory vaccines, and you've explained the thoroughness of the process that you undertook, including getting legal advice. But there may be those who are sitting and wondering, what if a person were to refuse to be vaccinated on religious grounds and in some instances, health grounds? How are you likely to navigate that space?
Yeah, thank you. This is the core issue, and thank you for asking that important question. The process is an individual, one-on-one consultation process. We're providing a toolkit and the appropriate support to our leaders. And through our Discovery People team, which is our human resources team, we will go through a formal engagement process characterized throughout by mutual respect. We do want to respect people's diverse views. At the same time, we do want a safe workplace, and we need to be able to balance those. So in the examples you give of legitimate and rational religious objections, for example, in those cases, we will need to find a means to reasonably accommodate those individuals. We do have very many different role types and jobs in Discovery. So it depends on that individual's specific skills, that individual's particular job, what their role type is in the job, and whether we can, in fact, jointly, in this process, which is underpinned by mutual respect, find a way to accommodate them within the workplace.
Yeah.
And we will put much effort and energy into this process of seeking reasonable accommodation where we need to.
Yeah. Deputy Minister John Jeffrey, let's come to you. There is, and this is now from Professor Musa Moshabela, a well-known public expert, who's also a medical scientist, who says we should not miss the nuances of compulsory versus mandatory vaccinations. Do you want to explain that, if you can?
I'm not entirely sure that I think what we have been talking about is, well, the issue is basically, on the one hand, government forcing everybody to vaccinate. You have to vaccinate. And if you don't, then there will be consequences for you. The other is what we've been talking about, that if you want to be able to do certain things or work in certain places, then you have to vaccinate. So that's my understanding. Others may have a different. I'm not too much of an expert on this.
Yeah.
But maybe one thing, not the question you posed to me, but on the religious side, as I said, it's going to ultimately be up to the Constitutional Court to rule on what's allowed, what isn't. Halton Cheadle and Professor Glenda Gray wrote an article, and they made reference to the fact that in America, which they describe as having the most conservative constitutional court in the democratic world, that over 100 years, the U.S. courts, including the Supreme Court and the state Supreme Courts, have, despite religious beliefs, held that laws that require vaccinations for smallpox and vaccinations of children to enter public schools are constitutional on compelling public health grounds. And as a result of that, all the states and the District of Columbia have established vaccination laws for public schools. So just what happens in one country doesn't happen in another necessarily, but just that's an interesting pointer, I think, in terms of if this matter goes to, if the religious issue is used to prevent mandatory vaccinations.
All right, let's pause there for a moment, and let's take a short breather. When we return, we are going to conclude this conversation. We're discussing the mandatory COVID-19 vaccination. Safura, before we went on that short break, I saw you itching to chip in there. What exactly did you want to add to the conversation?
My apologies, and thank you very much for giving me an opportunity. I had seen the tweet that you referred to about mandatory versus compulsory,
sure.
And just wanted to offer a point of clarity. That terminology is from bioethics. It's not a legal distinction that was being referred to. In legal terminology, we would refer to a vaccine mandate, which is something that applies at a population level and is really what we've been talking about here today, versus compelled vaccination, which is something that is done on an individual basis through a court order. You referred sort of to the example of XDR TB treatment. That would be an instance of compelled treatment, and the same kinds of things could be done under the National Health Act or under the state of disaster regulations as they currently stand. I understand that the government doesn't have an interest or intention to pursue that, but I just wanted to offer that point of clarity because I think it's something that's been going around, and it is just ethics terminology, not legal terminology that's being used there.
In fact, I'm glad that you've come in there. Let's perhaps wrap then and give you those last few remarks. As a way forward, what do you think government should be doing right now? The understanding is that the discussion around mandatory vaccination may not necessarily be underway from a government perspective. Yes, vaccine passports, that's a discussion that the DG says has been long in the pipeline. Talk to us about whether or not this is the opportune time to discuss mandatory vaccinations?
I think in some instances, the conversation is a little bit premature just because we haven't had, that many people taking the vaccine yet just because of how our rollout and our access to vaccines has worked. But I think this is happening at more or less the right time. As employers begin to introduce these policies, they need to be very careful that they're not prejudicing people who haven't been able to get the vaccine yet due to being far away from vaccination sites or having to wait for their appointments. But I think overall, it is the right time for people to start thinking about mandatory vaccination policies now, especially given that vaccines are now open to anybody over the age of 18. I do think that each person and each actor within South Africa has a significant role to play. I think the private sector and their activities around this, and people have described it in detail, restaurants, but also employers have an absolutely critical role to make sure that South Africa gets a high uptake of vaccine coverage and that the public is wanting to get vaccines. In terms of the government's responsibility, I think overwhelmingly in the public health sphere, we don't think that compelled vaccination is the right thing to do. You should try every other avenue first of trying to convince people, ensure that they're educated, informed, and able to access a vaccine and incentivized to do that. And only if all of that fails and there's really compelling reasons should you then be really looking at mandating people have vaccines when they really don't want to. So I think it's an ongoing conversation that will change as things unfold with the pandemic.
Dr. Noach, Discovery Health has become the first test case on this issue. Talk to us about what the reaction has been in the company.
Very interesting that I've received hundreds of emails and messages, as have my colleagues in our leadership team of support. Our core purpose at Discovery is to enhance and protect the lives of our customers and people. The reflection by our people has been that the core purpose isn't just words hanging on a wall. We, in fact, are acting and taking steps to enhance and protect our customers and our people's lives. And so this is very close to what we stand for and believe in, and in that regard, been well received. I would be dishonest not to point out that there are a group of employees who feel that this is unfair. We are looking forward to engaging with them and sharing our views and their views to understand diverse perspectives. They're divided into two kind of clusters, largely. The larger cluster are a group that I would call hesitant, where they're unsure and a bit frightened of vaccination. And it's very important that we provide them all the information, answer all the questions that they have, give them the necessary access to material to understand what they need to about vaccinations. And then on the margin, there's a second group, very small number of people, but there is that second group indeed, who one could call almost anti-vaxxers, that are diametrically opposed, that brand vaccines a toxin with a microchip and other myths. And in that regard, we would not consider those legitimate and rational reasons for not being vaccinated. There are unfortunately lots of myths abounding which are just not substantiated in science or with evidence.
Yeah, Deputy Minister, your thoughts going forward, particularly as regards the constitutional rights of people?
Look, as I've said, and as the President has said, the key issue would be, or the ideal situation would be, enough people want to go and get vaccinated, and we are not looking at compulsory vaccination at this point. Ultimately, with mandatory vaccines, if I'm using the right terminology for employers, as Discovery is doing, if there is a dispute and some employers have to be let go, as I think the terminology Dr. Noach used, that's probably a matter that that's a matter that will then end up in court and ultimately may go to the Constitutional Court. But I think there are compelling arguments, or strong arguments rather, for saying that the court may well rule in favor of the employer in terms of making employees vaccinate.
All right. And final word from you, Dr. Crisp.
Thanks very much, Tole. So I think that we as people living in society with one another have a need to interact with one another. We are human beings after all. And if our children want to see their grandparents in old age homes, if we want to go and watch shows, if we want to interact around a dining room table in a restaurant, if we want to get some semblance of life back, we need to do some things to enable us to do that. Some of those are the protection mechanisms we use now with mask wearing, face washing, proper ventilation, and so forth, which we have become very familiar with. But now we have a tool at our disposal, and this tool is vaccinations, and we know it's extremely effective. We see that people who are in hospital at the moment and people who are in intensive care in hospital are not the vaccinated people, it's unvaccinated people. And having so many people in hospital using those facilities who needn't be there because they could have been vaccinated is a great pity, and it's not something we would like to see. So we would like to see from the health department every single tool made available. So we will make vaccines as widely available as possible. We now, as you've heard, opened up vaccination to the 18-plussers. And once there's been sufficient time for the entire population to access vaccines, it's the appropriate time to start putting measures in place that start to limit right of access to various places or to direct that people must be vaccinated to access those kinds of services and pleasures. We do need to try and protect every work environment, every social environment, and do what we possibly can to minimize the next wave, which we know will come at some time, and get some semblance of order back. COVID will not be over with Christmas. We need to manage what we can manage in society, and we need to do it together, and this is just one tool for us to do that.
All right. Dr. Nicholas Crisp is He is the acting DG of the Department of Health. And to all the fellow panelists, I cannot mention you all by name, but thank you very much for your participation. This has been a fruitful discussion. Thanks indeed for your time. As we end this, let me throw forward to what we are going to be talking to you about at 5. We are going to be getting reaction on the medical parole that the former President Jacob Zuma has been placed on.